Hi, my name is Dr. Stephen Paget, and let's talk rheumatology. Today I'd like to talk about rheumatoid arthritis, specifically its therapy. So let me tell you about my approach. First of all, obviously you have to make the right diagnosis, and rheumatologists in general are able to do that. Patients will present with symmetrical polyarthritis, with fatigue, usually a high SED rate or C-reactive protein, and you have to check their anti-CCP and rheumatoid factor. The presence of those two will define a patient who may very well have a worse prognosis. Along with non-steroidal anti-inflammatories and maybe an initial short course of steroid to bring the thermostat down of the inflammation, a disease-modifying drug is clearly indicated. I usually choose methotrexate. I begin the dose at 12.5 milligrams a week orally, and I add folic acid 1 milligram a day. And within 4 weeks, if the liver function test and CBCs are stable, I go up to 20 to 25 milligrams a week. I even switch people to methotrexate subcutaneously if I feel that we're not getting a good response. It's important to treat to a specific target, just as you would using a glycosylated hemoglobin for diabetes. I use an MD hack. You can use a DAS or a GAS or a C-day or an S-day. I don't really care, but you need to use something more objective. If the disease is not under control, I often will move to an anti-TNF medication. If one anti-TNF medication initially works and then stops working in some time period, I go to another anti-TNF. But once the people stop responding to the anti-TNFs, I make a decision that that's no longer the arm of the inflammatory process that I need to focus on for that patient. And that's when I move away from the anti-TNFs after having used two to either Orencia or rituximab. The decision there is an individual one. The positives for Orencia is a shorter infusion time, and also the fact that it can be used after methotrexate or an anti-TNF has failed, if you look at the FDA approval. Rituximab is a 4.5-hour infusion initially, but the response can be over 6 months. The key there is to define when the disease is flaring. So the take-home lessons here are to be equally aggressive to the aggressiveness of the inflammation, treat to a target, and clearly move from one arm of the immune system to another, as defined by the patient's response. It's great talking to you, and I'll see you again soon.